George. My name is Carly and I will be your nurse today. Since you just got admitted, I'm going to be doing a head to toe assessment on you and look at your skin and just make sure your skin is healthy and that we identify all injuries. And I'll have another nurse named Shreya come in and look at your skin as well, just to make sure we catch everything, if that's okay.
Hi George, I'm Shreya. I'm the other nurse that's going to be helping Carly perform the skin assessment today.
So for the beginning of the assessment, we'll just, like I said, be going head to toe. So we'll just kind of look at your face and behind your ears, your head, and your neck and see what's going on. So I'm just gonna do hand hygiene, and put on some gloves, and we're just gonna kind of look. The face looks okay. Do you see anything?
No, I don't see anything.
And it's always important to look behind the ears because a lot of pressure injuries can be hidden behind there. So everything looks good. Does it look good on that side?
Yeah.
Okay, and then we'll just kind of like turn the head a little bit to each side just to make sure there's nothing on the back. I don't see anything on that side.
No injuries on this side.
And the neck looks good and the skin is intact.
Yes, and then next we're going to check your torso area and your back area to see if you have any injuries there too.
Okay, George, now that we've looked at like the top, your head and neck area, we're going to move on to the torso and the arms, the elbows, and then we'll roll you towards Shreya, and then we will look at the sacral area. So I am seeing a little bit of a wound right here, so we'll take note of that in Epic. And we want to look at your arms and specifically the elbows because there are a lot of times pressure injuries there. So I'm looking at the elbow. I don't see anything.
Looks good to me.
Okay, and then we'll go ahead and look at the other one. And I'm not seeing any breakdown right there. It looks intact.
Perfect.
And then I'm gonna roll you, and we're just gonna take a look at that box sacral area. Are you comfortable? Are you okay? Okay, good. So I'm just gonna take a look. And I'm not seeing any breakdown on the sacral area. Can you see?
Yep, everything looks good.
Okay.
I don't see anything on the shoulders either.
Yeah, the shoulders look okay, and I'm not seeing anything on the back. The skin looks good there. And next, we will move on to your legs and your feet and check on your heels. Okay, George, we've covered most of your body. So for the last step, we're just gonna be taking a look at your legs, your feet, your heels, and that area. So I'm just gonna pull this up just a little bit, and then we're just gonna take a look at the front of the legs, and your skin looks intact. I don't see any breakdown, bruising, any kind of abrasions, anything like that. Does that side look okay?
Yes, everything looks good.
Everything looks
here.
okay. And then an area that a lot of times patients have skin breakdown are the heels. So we're just gonna lift up your legs. We're gonna support your knees so that, and I'm not seeing any breakdown on this heel. Are you seeing any?
No.
Okay, this
Look like
looks
great.
good. Yes, and the back of the legs looked okay too. Okay, George, we are done with your head to toe skin assessment. Now that we're done, we're gonna exit the room for a little bit and go chart our assessment. Is there anything we can get you to make you more comfortable? Do you have any questions for us? No? Okay, we'll be back soon to check on you, okay?
Thank you.
Okay, now that we've done the head to toe skin assessment on George, we need to go into Epic and chart that it was completed within the first 4 hours of the admission. So I'll go in as the primary nurse and chart everything that we saw. We saw that scar on his abdomen, so I will make note of that. But other than that, his skin looked clear. So I will put that down. And then within 4 hours, you will also go into your Epic and sign off on it and say that we both had our eyes on his skin. And this assessment has decreased pressure injuries while in the hospital and also had a greater incidence of identifying pressure ulcers for patients when they first get admitted so that they don't continue to get worse. And it has led to numbers trending towards 0 on hospital floors.
I've seen it on our floor. Yeah.
Yeah.